Okay, welcome to the show. I'm Dr. Tony Delangel coming to you from the Gonstead Unfiltered podcast. Folks, again, I get excited about doing these talks. Today we got a good one. So if you're dealing with back pain, if you're dealing with sciatic pain or disc herniations or anything along those lines, this is going to be a great podcast for you as far as what you need to do, how you need to overcome it, and what you can expect just kind of moving forward with what I'm telling you. So it always starts with a story. I want to tell you guys a story. I believe I was about 25 years old at the time, and I was dealing with the worst case of sciatic pain that I've ever had in my life. So to the point where even if I were walking, every single step that I took, it just put so much pressure on my leg and my hip and my back that I couldn't even walk. So it got to a point where I went to my doctor. Now, 25 years old, I was in chiropractic school, which is kind of embarrassing to say, but you know, when you get to a point and you're getting adjusted, and it would give maybe a little bit of relief for maybe an hour or two, and then the pain would just keep coming back. So it was very humbling. And I remember I finally went to a doctor, a medical doctor, and I told him what was going on. Really didn't do anything. I mean, he didn't even take x-rays or didn't do anything like that. He just kind of wrote a prescription and referred me to a physical therapist. So I went. And, everything that happens in life, I swear it happens for a reason. And this was one of those moments in my life where, because of how it happened, it dictated how we were going to operate, even here at Gonstead Physical Medicine. So I go to the PT, and I remember they gave me this sheet and said, okay, just follow the exercises on the sheet. And so what we started with was electrical stimulation. They put some electrodes on my back, they put it on my glute, and did that for about 20 minutes. And then they give me this sheet, and then I'm doing these exercises by myself in the corner of this clinic. And I'll never forget this. The PT was actually talking to his colleagues, drinking coffee, having a good time, and I'm over here by myself doing these exercises. And I just thought to myself, what an absolute waste of time. And so I left, never went back. I was continuing to get adjusted, and again, it would give relief for maybe an hour, not even, like sometimes. And then finally I went back to the medical doctor, just frustrated because I was constantly dealing with this, and I was like, listen, something needs to happen because this is bad, and I've tried this. The PT, just gave me a sheet of exercises, and again, I came from the strength and conditioning background. Now let me give you some life lessons here. There's really 3 reasons why most people fail in their life. Number 1 is they're dumb. And not very many people are dumb, but they're, 5% of the world or whatever we can say are actually dumb, and that's why they fail in life. Number 2 is laziness. And you could say roughly 45% of people in the world are lazy. Okay, we'll give you that. And number 3 is arrogance. And I would say a good majority of people are arrogant. And so that was me, to be honest with you. I think I was just being arrogant, and it was just like, well, the PT couldn't help, and here I am, a chiropractor, and trying to, do all this stuff. Well, as a last resort, the medical doctor ordered an MRI finally. I get the MRI. I had a disc herniation at L5, which is the bottom disc in your lower back. And, the doctor was trying to paint this picture as to why that's the reason why I have this sciatic pain, that's why it hurts so much, and he was recommending that I do a steroid injection. Now again, being in chiropractic school, these are things that you don't want to hear about, but when you're in so much pain, things start to change. And so I was contemplating getting a steroid injection into my back, and I decided against it. I decided not to do it. So out of complete frustration, you get this mindset, especially in chiro school, where you're just thinking, okay, no medication, no this, no that, and there's a time and place for everything. But I did go home, and I remember that the next day I was so frustrated that I didn't go to the school. I didn't do anything. I dedicated that day to figuring out how to get rid of sciatic pain. I can tell you right now, some of your best doctors, and it doesn't matter what the profession is, some of your best doctors are the ones who had to suffer through something themselves, because they know what it feels like to get through something. They know what they had to do. And so now when patients come in and they see me, it's the same thing. I know what they're talking about. I know what they're going through, but they have to believe me when I tell them that there's certain things they have to do in a certain manner, in a certain fashion, in a certain sequence to get rid of this pain. And, we have a saying, it's, everyone wants to eat, but few will hunt. And what that means is everybody wants to get out of pain. Everybody wants to be happy and healthy and all these things, but very few are actually willing to do what it takes to get through that pain and to overcome that pain. And so I remember that day, I had this 5-inch ball, okay? It's kind of like a softball. And I just dug that into my glute, just kept digging, and I kid you not, probably for 2, maybe 3 hours. I'm just digging. It hurt like a son of a bitch. But every single time I would take a break, maybe after a few minutes, and I'd get up, I'd kind of walk around, and it would feel a little bit better. And so I'd get back down and I'd start digging into the tissue. Wherever it hurt is exactly where I was digging. I'd sit on it and I'd just be sitting there watching TV. And anywhere where it hurt, I just sat on it until the pain went away. When you're frustrated, you're willing to do whatever it takes. And so for those of you who are suffering with pain, you know what I'm talking about. You're willing to do whatever it takes to get rid of that pain because it literally takes pieces of your life away. And so I felt some relief, and then I'd get into that pigeon pose, where you're kind of like your front leg is into a 90 degree angle, and then your back leg is into a 90 degree angle, and I'm just leaning forward. And it's just, I feel this stretch in my glute, I feel a stretch in my hamstring, I feel a stretch in my lower back, and it felt good. So I would dig with this ball, and then I'd go into that stretch. I'd go back to digging with the ball, then I'd go back with a stretch. And I kid you not, I did the entire morning, maybe from like 6 a.m. until probably around noon. I was going back and forth, just trying to do that. And it got to a point, I kid you not, probably about 2-3 hours in, and I was starting to get relief. And then I would, put that ball on my glute. Then I'd put it on in the hamstring and start digging into any area in my hamstring where it still felt like that sharp, shooting, stabbing type of pain. Then I'd go into my lower back and I'd dig into my lower back until that pain went away. And then I did the other side, even though the other side wasn't as painful, but I just kept doing that. And then I'd go back into that stretch, and I just over and over and over until eventually I get up, I start walking around, and it just felt like great. There was no pain. And we're sitting around 1, maybe 2 in the afternoon, and I felt great. But I was so scared, I'll never forget this, I was so scared that that pain was gonna come back. So the rest of the day, I kept moving. Like every now and then I'd go back down, I'd dig into the tissue, I'd go into the stretching, I'd get up, I'd just start walking around. I was afraid to just do like nothing because I didn't want that pain to come back. And so had a pretty good night's rest, but then the next morning that pain came back. So same thing, I didn't take the entire day off this time, but I started digging into the tissue. I started stretching it out. I started moving. I started doing this. And I did this for an entire week, and before you know it, the pain was gone on a permanent basis after 1 week. Now, this is the first form of relief that I've had in that moment within about 3 months. Okay, so you got to think that 3 months of pain, 3 months of either going to medical doctors or PTs or chiros or anything like that with no results. And so as I graduated from school, the one thing I kept saying to myself was, there's something more to this, okay? And when I was going through school, it was like chiropractic is everything. And the reality is there's a time and place for everything. Chiropractic is great, but it's going to help certain things. It's the same thing with physical therapy. It's the same thing with medicine. There's a time and place for every single thing out there, but I share this with you guys because how many of you have had a similar problem and end up getting injections or surgery or burning the nerve, with a nerve ablation or doing something along those lines that causes damage to your tissues on a more permanent basis? And that's typically how it goes. You go to your doctor, they give you a diagnosis, and with that diagnosis, they may write a prescription for some pills. Those pills may decrease the inflammation, they may kind of take the edge off the pain. If it doesn't work, then you go back to the doctor, they may send you to the physical therapist. The physical therapist probably gives you a completely different diagnosis, And then you do a series of stretches or exercises, and it may or may not work. And if it doesn't work, then you're off to the chiro. Same thing. Different diagnosis, adjustments. Then you're off to the massage therapist. Same thing. Different diagnosis, a series of massages. And you can go to the acupuncturist, you can go to the naturopaths, you can go to every single one of these people. And they're all saying something completely different. You don't know who to believe. So the end result is you go home, you take your pills because that's the most convenient, and it's a downward spiral from there, and then you end up going back to the medical doctor, and then they end up either giving you the injection, burning the nerve, or you're under the knife getting surgery. That's how this goes. That's the nature of pain in the healthcare field. And it's super frustrating. I can't tell you how frustrating that is, and this is what started our mission here at Gonstead Physical Medicine. So throughout this process, I figured out, okay, step number one, you got to break up scar tissue. I didn't know it at the time, but what I was doing, even though I had a disc herniation, and here's what I want you guys to understand. Many of you have had x-rays and MRIs. If you've had an MRI and you've been told that you have a disc herniation, if I did 10 MRIs on 10 different people, I wouldn't be surprised if 8 of them had disc herniations, whether they feel it or not. So we can't just look at the ugly stuff that we see with imaging and think that that's what's causing the problem. We have to look at the individual. You have to check the quality of the tissue. You have to check their movement patterns. You have to check and use whatever information you can get to gather the information to actually see where the trauma is in your body. Just recently what we've done is we started doing thermal imaging, because in the thermal imaging, that's going to pick up real time where the trauma and inflammation is in your body at that specific moment. When I do an x-ray or take an MRI, whatever looks ugly, it's very easy for the medical provider to say, yep, that's why you have, your pain, because that looks ugly over there. And very rarely can you do that. Very rarely is that the case where you can actually look at an image, see something ugly, and definitively say that that is the reason why you have pain. But that's how most people do it. They don't even lay their hands on patients anymore. This is the most frustrating thing, and this is why at Gonstead, with my own personal experiences, we will never give you a sheet of paper and say, go do them in the corner of our office while we drink our coffee. We will never do that because it's so much more intricate than that. But there's a process. We came up with a 4-step process based off of my experience, based off of the experience that we've gathered, the information we've gathered with patients in our office for 24 years now. But step number one, you have to break up the scar tissue. And when you're breaking up scar tissue or adhesions in the fascia, in your connective tissue, within your muscles, when you break up that scar tissue, water can now pass through that tissue. So what happens over the course of time is our tissues, our muscles, if you feel your muscles, they should feel like a fresh piece of steak. And you know what I'm talking about. It's soft, it's supple, it's elastic, it gives. As long as your tissues remain like that, you're going to be healthy. You're not going to have pain. But what happens over the course of time because of either too much movement, which you see in athletes, or too little movement, which you see in the couch potatoes and just your everyday sedentary person, is that tissue starts to dry out because of these adhesions. So if you have an adhesion, if you guys are watching this on the video, if you have the muscle here and then you have this barrier of adhesion, water cannot pass through that adhesion and get into the connective tissue. So that tissue starts to dry out and turn into what we call a piece of beef jerky. And you know what beef jerky looks like. It's hard, it's rigid, it's not elastic. And if your tissue turns into that, then basically every single time you move, you try to bend over and twist or do something like that, and there's no elasticity in your tissues anymore, you're going to tear that dried out tissue even further and it lays down more scar tissue. It creates an even bigger adhesion. And before you know it, your tissues are just drying out, and by the time you can actually figure this stuff out, you look like a senior where when you turn around, your whole body has to turn around because you can't even move your neck or you can't move your lower back or anything like that. So step number one in this entire process is what I figured out on that day is you take a ball or you take some object and you push into the tissue to break up those adhesions, either by compressing the tissue or by creating some type of shear on the tissue. And when you do that, water will now pass back into the tissue and turn back into a fresh piece of steak. And that alone will give you pain relief, but that's not where we're done, okay? What we did right there is we broke up an adhesion, but it's no different than if you tear your skin, for instance, and you peel a scab off your skin, within a day, your body's gonna regrow another scab, okay? So the same thing happens with adhesions. You can break up the adhesion, and then the very next day, it's gonna start to grow back. That's your body's natural healing process. So there needs to be some level of consistency as far as breaking up those adhesions. That needs to be an ongoing, everyday thing for the time being or for quite a while until your tissues fully become hydrated again. But immediately after you break up that scar tissue, immediately after, the next step is you need to make that tissue elastic again. And you need to perform movements that are going to make that tissue elastic, like a rubber band, okay? And just like with rubber bands, you have to stretch it and you have to have some type of recoil. So when you stretch something and it recoils back, what you're doing is you're tugging on that tissue and you're making it more elastic. So there's a process out there called mechanotransduction. Basically what that is any type of movement that you do on your body is going to create a cellular response based off of that movement. So if we're talking about just even walking, okay, or if we're talking about lifting weights, we're putting a mechanical stimulus on our body and getting our body to adapt to make our tissues stronger, denser, healthier, more elastic, and then you're better, and that's how your body recovers. That's how we should be rehabbing ourselves. So that second step was basically to make the tissue elastic. And then finally, the last step is to build stability in the movement patterns that you have to do every single day to function and be healthy. Some of you, it could be lifting stuff, picking up boxes and loading them on trucks. Some might have to walk or run or throw or jump. Some are just sitting there, and that's the reason why, like, the human race right now is basically breaking down, is because most of us just sit and we're not stimulating our bodies the way we need to. So identify where the problems are first, okay? And you can find this in slow motion video analysis. We record people through certain movements. We look at the ratios of their movements, and we can identify what areas are moving and what areas are not. Then we do the thermal imaging to figure out exactly real time where is the trauma in the body and why is that tissue being damaged. Then we'll take a set of x-rays. Then we're running an instrument down the spine to pinpoint exactly where the problems are within the spine and within the joints. And we take all this information and put together a plan and say, okay, we have to improve the movement through here. We have to build stability over here. We have to make the tissue more elastic over here. We have to make the connective tissue denser, thicker, and stronger over here. And then we need to start building stability in the movement patterns that this person is doing just every single day in order for them to function. When we established this pattern, it led to a 98% success rate in our office. 98%. So I am so grateful that I went through that level of suffering to figure out how to get people out of pain like this. We didn't learn this through school. Nobody does. You might learn some myofascial release techniques. You might learn how to do chiropractic or how to do certain exercises or how to prescribe medication. But while all of that is fine and dandy, it never explained the sequence of how to get these tissues better. That's called experience. That's life experience as far as how did we figure that out? Through our own pain and suffering. And to this day, I'm 45 years old. To this day, I move better now than I did when I was in my 20s. So that's kind of my life mission. When I'm in my 60s, my 70s, my 80s, my 90s, I want to be able to still move and function. As soon as I lose that, I'm done. I wouldn't want to be alive anyways. But if I felt the way I do now, like back in my 20s or back when I was playing college football, there's no saying where I could have been. And so if you're in your teens or your 20s, maybe you're playing sports and you're constantly getting injured or whatever the case is, you got to start to look and think, okay, what is it that you're not doing that's causing adhesions in your body or your tissues to dry out like beef jerky? And is that going to put a limit on your athleticism? And is that going to put a limit on your career? But I share this with you folks because disc herniations are extremely common. They're extremely common. And it's not always the disc that is causing your pain. So if you've had an MRI because you have low back pain, neck pain, or whatever the case is, and you were told you have a disc herniation and that is the reason why you have pain, that is not always the case. And even if the disc was part of the problem, it's not all of the problem. And that's why you have to be all-encompassing and look at the entire system, the fascia or the connective tissue, how dried out is the tissue, the movement patterns. And based off of how you move, where is the stress being applied in your body that's creating these problems? You can look at the imaging, you can look at all of these different things, but you got to take a step back at some point and say, okay, why did this all happen? Everything in your body happens for a reason. So when you look at disc herniations, or just when you look at a disc, the disc is basically two components. There's a gel, or kind of think of it like a jelly donut. There's a gel in the middle of the disc, okay? And then there's this outer layer, these outer fibers that kind of contain that gel inside of the disc. And so what happens over time is those outer layers start to develop cracks and weaknesses through them. And now that jelly material, just like in a jelly donut, starts to squeeze through those cracks and eventually you have a disc herniation. If that jelly material comes out and hits a nerve, you're going to feel it. And a lot of times that jelly material will come out through those cracks and it won't touch the nerve and you're not going to feel a thing. This is why you can't just look at something ugly on an MRI and say, yep, that's why you have pain. But that outer layer of the disc, it's about 15 to 25 different layers, and they're all angled in different directions. How did they get angled in different directions? It's basically how somebody moves. If somebody's not moving, you're not going to see a ton of those layers being developed. But if people are moving optimally, and they're stimulating that tissue throughout their life, they're less likely to have a disc herniation. They're less likely to have damaged tissue and pain. And the reason why is because you have to stimulate those tissues. Human movement is 6 dimensions. We flex forward, we extend backwards, we side bend, we rotate, we compress, and we decompress. But what ends up happening is we lose the ability to rotate, we lose the ability to side bend to a certain degree, and we lose the ability to decompress. And this is why we utilize spinal decompression in our office, is because spinal decompression can take a joint and pull that apart, and it creates like a negative vacuum-like pressure. When you pull the disc apart like that, you're bringing in nutrition, you're bringing in fluid into the disc to help rehydrate these discs. You're bringing in that nutrition to help that disc tissue heal itself, regenerate itself. But most people, because we just sit all day long, we just stay in the state of compression. We don't rotate. So number one, spinal decompression is great because it can help decompress the disc. It feels like you put more padding between your bones. And it can help fix disc herniations from a non-surgical standpoint. But again, you just can't stop there. So when we do spinal decompression in our office, it's not just spinal decompression. You have to stimulate the outer layer of that disc to make those tissues strong, dense, and elastic. And the best way to do it is not to go and squat and bench and deadlift and do the things that you see people doing in gyms. That's not the way that we want to approach this. What you do is you have to mimic natural evolutionary movements, because that's how it is. Let me ask you guys something. You ever see a lion and they injure their leg, for instance? Do they go to the physical therapist and do isolated exercises? No. They don't go to anybody, right? They move. And they move based off of their natural evolutionary movement. So when we're talking about human beings, we should be no different. We're just a different species, but we should be no different. So what are the natural evolutionary movements that have made human beings look like human beings? Walking, running, jumping, throwing. Now there's more things that you can do, obviously. But if you look just at, from a first principles basic standpoint, how did the human body evolve to look the way it does? If you look at the deltoid, right? How did the deltoid, or the shoulder, how did the shoulder develop and evolve to look the way it does? Think about when we were running. We were running and hunting down an animal. Sometimes we had to sprint. Sometimes we had to jog. Sometimes we had to throw a spear. So if you think about that, in the shoulder, in the evolution of the shoulder, it came from driving the arms back and forth when we're running. It came from actually the throwing motion of the shoulder by throwing rocks and spears. And you do that over the course of time, that is a form of mechanical stimulus. Remember that whole word, mechanotransduction? That is a form of mechanical stimulus that gets your body to lay down collagen oriented in the direction that it looks like on the human body to make the shoulder look the way it does. So when it comes to rehabbing a low back, how is the low back designed? Well, when we walk and run, we see some flexion, we see some extension, we see side bend, we see rotation, we're decompressing, we're compressing. All those 6 degrees of movement are what are created. And so you better get back into that if you want to fix a disc as well. We don't isolate muscles. We get back into the natural evolutionary human movements to help stimulate those the connective tissue around the disc, the layers of the disc, to lay down collagen, to strengthen those outer layers of the disc, to make them stronger, to make them more elastic, to make them more dense. So that way, that gel material that's on the inside of the disc cannot seep out and herniate through the disc. You got to keep that tissue strong, dense, and elastic. But think about it. If human beings are 6-dimensional as far as our movements, how many people actually do those 6 dimensions of movement on a consistent, everyday basis? It doesn't happen. So we have to get back into, and here's the best part about it. Everybody thinks they have to go to a gym. They have to do this. They have to isolate muscles to get things stronger. That is so far from the truth. You don't need to buy equipment or anything like that. You can go outside and you can just walk. Start by walking. And then eventually when you're up to it and you kind of build some endurance and you kind of build that connective tissue just from walking, then you can get into more of a run. And I'm not talking about a long distance run. I'm talking about maybe you run for 10, 20 yards and then you walk a minute. Then run for 10, 20 yards and then you walk a minute. And then you build and condition your body to become more elastic and get that connective tissue stronger, denser. And eventually you can go more into a faster run, and then eventually into a sprint, and then you can get into your throwing motions, and so forth. But if you stuck to movement patterns that consisted of walking, running, jumping, throwing, your body's going to be pretty functional. So when we talk about disc herniations, yes, we want to know where is the herniation, but more importantly, where are the adhesions around that disc herniation? Number one, we got to break up all those adhesions. And really, you got to break up all the adhesions everywhere in your body. But break up the adhesions so water can go back into the tissue and the disc can start to get good nutrition. Then you have to make that tissue more elastic. And you do that by you have to create some type of recoil. So when I walk, run, jump, and throw, I'm creating recoil in my body. Every single time I run, you see my trunk or my torso rotate, and when my right arm goes forward, it's pulling on the connective tissue in my lower back on the right side, and then when I drive my right arm back, my left side is being stretched, and it's just back and forth, and you're creating elasticity in your body. But when you do that, all of a sudden your tissues become more elastic, and we use a lot of water bags and water balls in our rehab department, and the reason why we use that is because you can mimic those natural evolutionary movements with resistance. So I can put a water bag over my shoulders and I can rotate and act like I'm walking or running, or I can take a water ball and actually act like I'm throwing it and mimic the movement patterns, and it's applying a resistance to those tissues, so it's giving my body even more stimulus to lay down even more collagen or connective tissue to make my tissues stronger, denser, and more elastic. And the water that's in the bag and the ball, it's going to throw you around, so your body has to learn how to stabilize itself in the movement patterns. So this is the kind of rehab that basically transfers into your everyday life to make you a functional human being. That's how you do this, folks. It's not going to be by giving you a diagnosis. It's not going to be by giving you pills. It's not going to be by giving you a sheet of paper and having you go into the corner to go do some stretches or some exercises. It's not going to be just from giving you an adjustment. And I'm a chiropractor telling you that. But all of those things in combination, in the right sequence, are what it's going to take to get you back to where you need to be. Break up the scar tissue. Make the tissue elastic. Build stability in the movement patterns that you need to do every single day. That is how you fix pain, folks. That's how you fix herniations. That's how you can get rid of sciatica. That's how you can get rid of numbness or tingling, whether it's in your legs or your arms. That's how you get rid of your headaches and your neck pain and all these different things, your shoulder problems. If you follow the sequence, you will get your life back. So hopefully this helps, folks. And if you guys have any questions, or if you need assistance as far as following through this process, always give us a call, because this is why we exist. We follow that process. It doesn't matter the condition. You just have to be a human being, and we just have to be able to identify where those adhesions are so we can get to it. So folks, I hope you enjoyed this episode here. If this helps you, we ask that you please pass this along. One of the things there's so many people in pain, and do not let you or your friends or your family end up getting the injections, getting the nerves burned, getting the surgery, only to lead to a further downward spiral down the road. So if this helps, folks, we ask that you please share it, please rate it. If you have any questions, always feel free to reach out to us. But until next time, folks, I'll see you then.